Thank you. Good evening, and thank you for joining us for this very important webinar, Getting Back on Track with HPV Vaccination, Understanding the Importance of Preventing Cancer. My name is Marlene Vignier, and I serve as the Regional Minority Health Analyst at the U.S. Department of Health and Human Services, Office of the Assistant Secretary for Health in Region 2. With my role, I'm able to lead national and regional initiatives to eliminate health disparities, promote disease prevention, and advance equity in a collaborative forum with federal, state, local, territorial, tribal, and community partners. In addition, we aim to promote culturally and linguistically appropriate services, provide technical assistance with program activities, and help assess community needs and workforce development. We are very appreciative of you joining us this evening from all across New Jersey, New York, Puerto Rico, the US Virgin Islands, and beyond. The New York Vaccine Literacy Campaign at the City University of New York, also known as CUNY, School of Public Health and Health Policy, and the HHS, Office of the Assistant Secretary for Health, OASH, in Region 2, created this opportunity with the purpose of responding directly to the concerns and questions that individuals have about the human papillomavirus, also known as HPV, having this information to help make an informed decision about the vaccine, which can help prevent cancer. We collected questions and concerns from community members and created an expert panel to speak on topics participants wanted to cover. I am honored to facilitate this dialogue as your moderator, and we have invited each of our guest panelists to answer questions from their diverse experiences and perspectives. Before I introduce our panelists, I will share a few technical reminders for today's session. All participants will be muted. Closed captioning and Spanish interpretation are available and located at the bottom of your Zoom screen. And while you're listening to our panelists this evening, please feel free to use the chat box to share questions and thoughts that you may have. Followed by the introductions, we'll have a moderated discussion with our panelists. And lastly, today's event will be recorded in English, and we will share the recording along with the resource document and speaker bios following the event. We also appreciate your feedback and will include a survey link for your response. Now, for all of our events, we must provide the following disclaimer. The views expressed in this webinar are those of the speakers and do not necessarily reflect the official policy or position of the U.S. Department of Health and Human Services or the U.S. government. The linked content may not comply with all of U.S. government guidance for websites. All right. Now I'd like to start off and take a moment to introduce each of our panelists. Our first panelist is Dr. Tia Welsh, Chair of Women's Services at Valley Medical System. Dr. Welsh is a native of Staten Island, New York. She earned her bachelor's in art from the University of Virginia and received her medical degree from the State University of New York, also known as SUNY, downstate in Brooklyn. From there, she spent 4 years working at Kings County Hospital for her residency and continued her work for the New York City hospital system, working at Lincoln Hospital in the Bronx for the next 8 years. It is at Lincoln Hospital where she started on a path of leadership. She wrote the grant and became the co-director for the Family Planning Clinic. She also became the Associate Residence Program Director at the clinic. As she continued her passion for teaching, Dr. Welsh also became a fellow for the Health and Hospital Simulation Center, where she taught every physician, nurse, and anesthesiologist about the labor and delivery units throughout the city hospitals, how to deal with obstetric emergencies, Dr. Welsh, after 8 years, then landed a role as the regional director and the director of women's services for the largest federally qualified health system in New York State, working out of Long Island. She led physicians across the Hudson Valley, New York City, and Suffolk County, Long Island. After a successful 6 years in that role, Dr. Welsh is now leading physicians and advanced practice providers at the Valley Hospital System in Bergen County, New Jersey. Dr. Welsh is passionate about women's health, equity in women's health across all races and financial status groups, and strives to bring about awareness and change in the landscape of maternal morbidity and mortality in this country. Next, we have Alexandra Serta. Alexandra is first generation Dominican American and born and raised New Yorker. As a teen mother, she has always been passionate about the intersection of parenting and health communication with her 2 sons. She received a health education Bachelor of Science with a minor in middle and high school education from the City University of New York, CUNY Lehman College. She has dedicated her professional career to providing youth with healthy, affirming, and shame-free sexuality messaging that she thinks all youth deserve. And finally, we'd like to welcome Taylor Drost. Taylor Drost. Taylor is a Master of Public Health MPH candidate at the CUNY Graduate School of Public Health and Health Policy, and as well as a program assistant for the New York Vaccine Literacy Campaign. Taylor will be receiving her MPH in Community Health with a specialization in maternal child, reproductive, and sexual health. She has experience conducting mixed methods research studies and has worked in government and is currently working with a nonprofit organization advocating for reproductive justice and the rights of pregnant women. Wow, we have a lot of wealth and experience on our panel this evening. So really excited to get the conversation going. So we'd like to start out by asking one introductory question to all of the panelists. When we reached out to you that we were putting together this event, you each said yes. We are grateful for that. And because each of you have such unique perspectives and experiences that you are seeing HPV's impact from so many different angles. And we think that is necessary toward addressing the various kinds of concerns individuals have. We also would like to first discuss your why. What impact have you seen in your respective fields that made you say, yes, I would like to speak about this? Dr. Welsh, let's start with you.
Thank you, Marlene, and thank you for that introduction.
No problem.
As far as your question is concerned, my why is seeing the impact of not obtaining the HPV vaccine. Over the past 2 years during the pandemic, it was really hard to get people in the offices, obviously. Preventative services decreased. And as a result of that, we are seeing an increase in cervical cancer. HPV, as we know, is one of the leading causes and is the main cause of cervical cancer. And this is something that we don't typically see people dying from in this country because of the HPV vaccine and because of the preventative test known as the PAP test. We can avoid cervical cancer and deaths associated with cervical cancer. And because of that, because of the pandemic, not a lot of people have gotten all of their vaccination for HPV, or they have not obtained any HPV vaccine, and the rate of cancer, especially in this area, has been increasing.
Thank you for sharing that. And we look forward to hearing more as an OBGYN, the importance of this preventative measure that can help lower the risk factors for obtaining cervical cancer. Taylor, we are so excited for you to be here because you represent the voice of the future. And as the voice of the youth out in the community, why do you feel compelled to join the conversation today?
Sure. So as an MPH student and someone who works for the New York Vaccine Literacy Campaign, I'm very passionate about vaccines in general. And it's my personal experience with HPV and the vaccine, I would like to say, has been unique, but it's actually incredibly common among young people around my age. I'm 24. My experience has been very impactful in my own life. So I hope that by sharing my experience, it will help others to make the most informed decision possible regarding this vaccine.
Sorry about that. I was having trouble getting off mute. Thank you for that. And we look forward to hearing more about your personal experience and testimonial. And lastly, Alexandra, you are a mother of 2 boys, committed to your work in youth education for over 13 years. Can you tell us a little bit about why you wanted to speak today through this panel to other parents?
Yes, thank you so much for having me and creating an event like this. I think this is so great to hear from all different aspects or different elements. And I just really wanted to come in as a parent and share my experience, answer any questions folks may have on how I, kind of like went through my through my path and the conversations I had with my child about it.
Great. And we're looking forward to that perspective as well. As you can see, we have different unique perspectives with our panelists, and we're grateful for your presence this evening. There is a wealth of knowledge that can be shared, as well as diverse experiences here. And we're just excited to have it all in one place, a safe space, so that individuals can receive answers they need and that will help them make informed decisions about their health and the health of their youth. So to all of the attendees, please, again, feel free to use the chat box to share any questions that you may have or any thoughts from the remarks that are being shared by our panelists. We'll try to answer as many as possible. So we'll start off with you, Dr. Welsh. You started to mention how the HPV vaccine can help prevent cancer, cervical cancer in particular. Can you provide a brief overview of what HPV is? And is it common?
HPV, also known as human papilloma virus, is a sexually transmitted virus that can cause both cervical cancer and genital warts. We do know that HPV has many different strains, sort of like the flu virus. And there are 4 strains that we know are highly likely to cause cervical cancer that I think they're associated with numbers 6, 18, 31, and 33. Those HPV strains can be detected in a Pap test. And when we have those strains on a Pap test, we can sometimes remove cells, freeze cells, burn cells, so that they don't go on to develop cancer. And when I say sexually transmitted, it doesn't actually it includes intercourse, but viruses are usually spread through skin-to-skin contact. HPV is not something that you can see, and there are no symptoms related to it. So there's no sores, there's no itching, there's no discharge associated with it. So thus, because of that, it is extremely common in both men and women.
Thank you for that. That was a really great overview. Now I'm going to pass it on, my next question, over to Taylor. Can you tell us a little bit about what motivated you to get the HPV vaccine?
Sure. So when I was about 11 years old, my pediatrician recommended to both myself and my mother to have me vaccinated for HPV. And at the time, it was a very new vaccine and my mom was nervous, so she decided to not have me vaccinated. So fast forward to when I'm 18, and now it's my decision, and it was brought back up to my attention, but I just didn't feel that it was necessary. I wasn't sexually active at the time, and I didn't think that it was something I needed, so I chose again to not get vaccinated. Then about 1 year ago in 2021, I had a routine checkup at my gynecologist, and they did a pap smear, and it ended up coming back abnormal. That was when my doctor informed me that I had also tested positive for HPV. After that, my doctor had me come in for something that's called a colposcopy, which I'm sure Dr. Welsh can explain more about. But to my understanding, they take a piece of your cervix for a biopsy to see if it's cancerous. So when I went in for this, she had also told me that I tested positive for 2 of the most aggressive strains of HPV that can lead to cervical cancer. So I was incredibly upset and nervous, thinking that this meant that I had cervical cancer or that they were going to have to take my entire cervix out. But she reassured me that this was actually very common, and this happens a lot of times for people my age. I was 23 at the time. So luckily the results came back negative for cancer cells, but now every 6 months I have to return for a routine pap smear until I have 3 consecutive normal pap results. But so my doctor informed me that it typically takes about 2 years for the human body to clear HPV, although everyone's different. And I'm very lucky because I have an open and honest relationship with my gynecologist. But so she was able to tell me that I'm still within the age range for recommendations for the vaccine. So she recommended that I get vaccinated, even though I tested positive for HPV, since there are other strains that can lead to cervical cancer. So after finding that out and finding out that my insurance does cover it, I decided to begin the series to get vaccinated.
Wonderful. Thank you for sharing your story. And before I get to you, Alexandra, I just want to go back to Dr. Welsh. I know, Taylor, you mentioned colonoscopy and routine screening. So just wanted to put over to Dr. Welsh to see if you'd like to share additional remarks about the colonoscopy and anything else regarding the routine screening after one tests positive for HPV.
Yes, actually the test is called colposcopy as opposed to the colonoscopy
sorry,
for your colon. It's
sorry,
okay.
Everyone, I got a little tongue-tied, sorry.
No, you don't need a colonoscopy for
No,
abnormal pap, but you do need a colposcopy, which is done in the office. And as Taylor said, it is a biopsy of the cervix to see if the cells are indeed infected with cancer cells. And what we're looking for before we even get to cancer are actually precancerous cells. Cervical cancer is a slow-growing cancer. So if there are precancerous cells, again, we can simply laser those cells away. And, with the addition of a pap test and the HPV testing within the pap test, we can detect abnormal cells. And when she said some people are able to clear it up, I relate HPV sort of to herpes, more or less. Herpes you have for life, it's a virus. And HPV you do have for life, but sometimes it's more active than it should be. And that's when we detect it in the pap test. So it kind of lays dormant. And so everyone with HPV won't get cancer, but most people with cancer do have HPV. So there are some times when you may have a pap test and you've had a bunch of normal tests your whole life, and all of a sudden you have HPV. It doesn't mean that the partner you have today was the actual one that transmitted it, because it could have lied dormant for a long time. Once you're sexually active, it's probably a little too late to think that you won't ever get HPV, because you've already come in contact with some type of HPV. That's why vaccinating adolescents is key before sexual activity.
Thank you for that. And also that background on the type of testing that is being done. Now I'm gonna come back to you with a follow-up question, but before doing that, going to Alexandra and ask, some parents ask, why does my child need HPV vaccination? And aren't they too young to receive a vaccination to prevent sexually transmitted diseases or infections? Dr. Welsh just suggested that it's encouraged to get the vaccine before a youth becomes sexually active. So what do you say to that?
Yeah, so definitely just like Dr. Welsh and Taylor mentioned, I had a similar experience where I went in with my child to get his his annual physical, and the doctor mentioned it when he turned 11 that this was an option that we had. For myself, I've heard about the HPV vaccine and I didn't get it when I was a teenager myself. So I hearing about it from doctors from time to time, I thought it was extremely important for him to do it. So I asked a few questions. The age, I was wondering why so young as well. And what the doctor mentioned is that it's better and it's more effective if it's before the child becomes sexually active. So my thing was always having an open communication and feeling comfortable with asking those questions. They went into detail about the series and how many vaccines and what can I expect. Luckily, my child has never had any side effects when he has gotten any vaccine at all. So I felt completely comfortable and I thought it was the right thing to do, just, to avoid anything, to prevent. At that time, I didn't hear so much, to be honest, that it was to protect him as much as it was to protect other people he might come in contact with. Thank you.
It's great that you were able to be so proactive with your son's health and speak with your provider to ensure that he's able to get the vaccine. Dr. Welsh, Alexandra just mentioned about the age and just wanted to ask you, why is the HPV vaccination recommended for children as young as 9 years old? And do you also have any latest recommendations for the age range and HPV vaccination that you can share with us?
So the companies that make the two different types of HPV vaccine do recommend starting that series at age 9. The CDC also says that young adults as young as age 9 can receive the HPV vaccine, but most pediatricians and on their pediatric immunization chart will start at age 11. Before age 9, they're still in their pediatric vaccination age ranges. So just at that turning point of age 10, I think that's their last pediatric immunization, and then they start the HPV. It doesn't really matter whether you give it at age 9 or give it at age 11, but at age 9, they're still getting their other routine vaccinations. And hopefully we don't have a whole host of people in this country that are having sex at age 9 and 10. So they can wait to age 11. And as Alexandra says, before age 15, the vaccine is a little bit more effective if given before age 15, before sexual activity occurs. After age 15, it's a 3-dose series, and before it's a 2-dose series. About 3 years ago, maybe 3 or 4 years ago, the recommendation came out that the vaccine can be given to those after age 27. So before then, it was only from age 11 to 27 that the vaccine was given. Now, between the ages of 27 and 45, the vaccine can still be given, but that's between the patient and the provider. If you still have high risk factors, meaning you have multiple sexual partners, it is recommended. If you've had abnormal paps in the past, it is still recommended after age 27. And as both Taylor and Alexandra said, just because you have one type of HPV doesn't mean that the vaccine cannot prevent the other 3 high-risk types of HPV that you can still come in contact with.
So it's still a great preventative measure that one can take and should be considered and talked to with your provider to find out what would be best for the individual, it sounds like. Now, Taylor, you had mentioned in your remarks how you were able to make this decision with your provider. What advice would you give someone that is on the fence about getting the HPV vaccine?
I would definitely advise them to discuss it with their provider as well. If we're talking about someone who sees an OBGYN, then they should discuss with that doctor. If it's someone who does not have a doctor, then they should probably find one, and one that they can build a good relationship with and foundation with, that they can have this open and honest conversation, since the relationship that I have with my doctor was so influential on my decision. But I would recommend just learning as much as you can about it and making the best decision possible for yourself and your body, and hopefully protect yourself and your potential future partners as well.
Thank you for sharing that. And Alexandra, some parents are concerned that their child may think getting the vaccine makes it okay to have sex. What are your thoughts about that?
Yeah, I definitely can see some concerns around that. You know, for me, I feel that it's just offering more information and really protecting them and keeping them safe. I think it can lead to conversations around, like, you know, what can happen if you decide to be sexually active. And, you know, I think those conversations can always be positive. But information just helps folks make informed decisions. You know, that's all it really does. It doesn't give anyone the key or the card to, you know, to engage in any type of activity that they're not wanting to, or start anything any earlier. It's just really about giving that information so they have, you know, all the information that they need to then make the decisions that they want to.
Definitely agree. Doesn't hurt to get more information, and accurate information. That's the key, right? To be important with that. It's been shared, and several of you have touched on it, that the HPV vaccine comes in a series. Dr. Welsh, can you share more about the series, especially with the pandemic, if someone started and then the pandemic happened and they weren't able to continue the series? What
So
should they?
as I stated before, if less than 15, this series is a series of 2 shots. So you get the first shot, and then between 6 to 12 months later, you get a second shot. After 15, the series is 3 vaccines. The first, then within 2 months, you get a second, and then within 6 months, you get the third. Now, in New York and in the metropolitan area, New York, New Jersey, the rate of completing a series of HPV vaccines is extremely low in the adolescent population. So you can imagine during the pandemic, if you got 1 shot or 2 shots and you didn't get your third or you didn't get the second, many people did not return. Does that mean it's too late to get that second or third shot, even if you got it a year ago? No, it is not. You can still get your HPV vaccine. There's no limitation on when you can complete the series. There is a limitation on when you can get the next one, where you want it at the very minimum, at least 4 weeks apart, but recommended no less than 2 months. But there is no limit on the expiration on when you need to get the last shot. You don't need to repeat the whole series if you've missed out for a year or two. You can just pick up where you left off.
Thank you for sharing that. That's really good to know. And Alexandra, I'm gonna go to you with this next question. As a parent, who can one talk to if they have questions about whether the child specifically should get the HPV vaccine?
Yeah. I think a great place to turn to is kind of like your own community and your village, those trusted folks that you know and you have in your life. At times that can include the doctor, and at times it doesn't. When it does, it's, you know, that's an amazing thing. I think it's great to have that relationship with your primary care provider, and really feel comfortable to ask those questions. And then in kind of like on the flip side, if you don't feel comfortable having those conversations, I think that folks, should understand and know that they have a choice and they can, go to another doctor, and whether a family recommends a doctor or a friend, you don't have to stay with a doctor just, for insurance purposes, if that's what someone is thinking. We know that communities are all made up of different folks, and sometimes that relationship, for whatever reason, just isn't there. And then, turn to your trusted village that you have, speak with people, don't be afraid to ask those questions, because you can find someone who has had, whose child has had the HPV vaccine, and, they can share their experience and what it was like for them.
Thank you for sharing that. Making the provider part of your trusted community is important, but also being able to go with those that you can lean on to have this open discussion with, and making your best informed decision is valuable. Taylor, keeping with the theme of community and sharing your personal experience, thank you again. Have you shared your decision with your peers by any chance? And if so, what were their responses?
I have shared my decision with both family and friends. When I was letting my mom know what was going on, she regrets not having me vaccinated when I was younger and carries around some guilt that I have to experience this now. But obviously, I don't blame her at all. But so I've also had this conversation with friends, and all of the responses have been positive, but they've been mixed in that a lot of people were unaware of how common HPV was, and how common it is for it to either lead to an abnormal pap or to potential cervical cancer. And then a few people that I also know had similar experiences, which was actually sort of reassuring, because now I'm not the only one that I know who's going through something like this, and we can sort of share our personal experiences and be a support system for each other. And it just helps to alleviate some of that stress of the unknown of what comes next, what's going to happen, and is it only me that's going through this? And so I'm lucky with the support system that I have, that all the reactions I've had have been positive, and also people have been willing to learn and fully understand what can happen if you don't get the vaccine.
That is positive to hear, being able to lean on to those that may have similar experiences with you, and then also sharing in your experience, being able to learn from one another and passing along some valuable information to others. Dr. Welsh, so we're gonna go back to some more of the clinical aspects of HPV and the vaccine, and wanted to ask if there is an HPV test for other parts of the body besides the cervix. It was mentioned that you still will need to have a pap and HPV test, but are there other tests that one can take?
Yes, there are pap-like tests that can be done in the anal area, especially for men that have sex with men, or even females that engage in anal sex. There is a small percentage of people that have anal cancer that can also be associated with HPV. So one might ask, as I say that HPV is associated with cervical cancer, why should young men be vaccinated? One, to decrease the spread of HPV, but two, there is a minuscule chance that men can come down with penile cancer that can be associated with HPV, as well as anal cancer as well. I'm not sure the age of the audience, but Michael Douglas, a very famous actor, had gotten divorced from his wife, then I believe was Catherine Zeta-Jones. And I just remember him making a really obscene comment that he obtained throat cancer because of his wife and performing oral sex. And I thought that was just a really piss poor way to talk about his wife, and something that they probably shared together, the HPV infection. And again, it is unclear, unseen, untouched. You don't know who's infected with HPV just by looking. So men can get HPV related cancers. It's just extremely rare.
Thank you for sharing that and also highlighting different HPV related cancers that can happen among men. I just want to continue with this conversation that are there symptoms that may be different for people of different genders?
As far as symptoms, there's no symptoms related to HPV. The only symptomatology that one may have is obtaining genital warts. Now, genital warts are little skin tags that can be located in the genital areas. And those are associated with HPV outside of 16, 18, 31, and 33. There are other numbers that are associated with genital warts. Those could be frozen off. Those are not going to kill you. Sometimes they can be unsightly if they're numerous. However, other than that, there are no symptoms related to HPV.
So then what's the difference between, just to clarify, between HPV and genital warts?
HPV causes genital warts.
Thank you for that clarification. Alexandra, this next question's for you. Where did your kids receive the HPV vaccine and what was their experience like during and after?
Yeah, so my oldest one is the one that has received it. He was around 11 and we just got it with his pediatrician. It was just part of, they shared with us part during his annual visit, told us it was an option. He got his first dose there and then we had to come back a few months later for the second dose. And as I mentioned, we didn't see any side effects. Ever since he was young, he never really received any side effects from any prior vaccines. He was still young, so there weren't really any questions that he asked. To him, it was just going to the doctor again. But the experience alone, the doctor was really, really shared what we can expect, what it would be like, even down from like how long it's gonna take, like the waiting time and, just what can we expect, and even how to have certain conversations if questions did come up, which they didn't since he was so young again.
Okay, thank you for sharing their experiences. And it also just exhibits the importance of having a provider that's open and being able to engage with their patient when getting such preventative care. So that's really important, building up that relationship. And Taylor, what do you tell people when they ask if they should get the HPV vaccine?
My general answer is yes, they should get it. Of course, they should consult with their doctor, whether that's a gynecologist, a pediatrician, depending on their age, or a primary care physician, since I'm aware that there are medical conditions that can make it difficult or impossible to receive a vaccine. But if you are capable, then I tell people that they should get it. It can only protect themselves or the people around them.
Great advice. And on the lines of advice, I'm going to open it up to all the panelists. What advice do you have for individuals that worry about getting or having the HPV?
I would say one of the number one questions that women ask when they come in and find out that they have HPV, it's who gave it to me? That's number one. That's not an answer that we can usually give unless they've only been with one lifetime partner. And two, do I have to relay this message to every partner I have that I have HPV and how this is going to affect their fertility as well? And I would say in this country, by the time you turn 50, everyone has you have come into contact with at least one HPV virus. That's just a fact. Whether you are infected and the cells are whether the virus is replicating at an active rate during the course of your life, that is another question. So saying, hey, I have HPV, do you still want to be with me? It's really not necessary. You know, and the conversations after having an abnormal PAP is, hey, I had an abnormal PAP. It looks like I have HPV. So I just got to get checked out more often just to make sure that I don't have cancer. That's how that discussion goes. It doesn't get any more serious than that. And I don't think having HPV is a death sentence either. It doesn't affect fertility. It doesn't affect how you will deliver your children either. I think women can have a normal, fruitful life and sexually active life, even having HPV.
Thank you for sharing that, especially the concerns that one may have and some remarks about how you can engage and have a conversation with your partner or partners, and how to maneuver if, you know, just to move on when, if you're diagnosed, but there is, you know, testing that one can take to monitor their care and reduce their risk. Taylor, Alexandra, do you have any additional remarks after Dr. Walsh's?
Sure, I can speak to that question. As someone who has HPV, I know it can be scary when you find out that you have it, especially getting an abnormal PAP, but that you'll be okay. As long as you speak to your doctor and you take care of it. I think this really solidified how important routine checkups are, especially once you hit the age of 21. I believe that's when you are recommended to start PAP smears, unless that changed. But you know, I had skipped a year in 2020 because of the pandemic, and then when I went back in 2021, that's when I had the abnormal PAP. So I'm glad that I went and caught it when I did. I don't know if I had waited a few more years, if it would have been cancerous after having the colposcopy. So I think that I'm a big advocate for going to the gynecologist, as annoying as it may be for some women. I think it's very important.
Thank you, Taylor, for sharing, and, you know, also taking care and continuing your preventative care. You know, even though the pandemic disrupted our routine visits to the doctor, it's important when possible to get back and speak with your providers and try to continue the preventative care that's being provided to us. Alexandra, I just wanted to touch base to see if you had any remarks.
Not really much to add. You know, I just definitely encourage folks to go see the doctor, right? No matter what diagnosis is, go see a doctor, continue to receive treatment and ask those questions. I think it's important for everyone to know their own body, but just knowing your own body doesn't mean like I can skip going to the doctor, I don't need it. It's definitely something to do, and really encourage that relationship. And really, really early on, conversations I have with my child, I let him know that, you know, I'm at the age where they ask me to leave, to step out of the room so they can have certain conversations with him. And I assure him, you know, like if there's something that he doesn't feel comfortable telling me, that you can always tell the nurse and the doctors. And those are the folks that you should really have that communication and relationship with, so they can, you know, give you the proper treatment or information that you need, and that information is confidential. Like they are not allowed to tell me any of that. It's like legally they cannot tell me anything. So that's really my, you know, my message around that.
Thank you for sharing that. And it's great that you are so supportive with the preventative care of your sons. And we just touched on some advice. Oh, Dr. Walsh, would you like to add to that?
I just want to say that both Alexandra and Taylor exemplify what should go on in a doctor-patient relationship. And I think Alexandra touched upon it before. Just because you go to one doctor doesn't mean that's going to be your lifetime doctor. And if you don't feel comfortable with your physician, you're not going to be comfortable with the treatments or the advice that physician or clinician is giving. And one way to make sure that your clinician, I'll say clinician because some people have nurse practitioners, but one way to make sure that your clinician is being patient-centered is when they have a conversation with you and ask you how you feel, as opposed to talking at you and telling you what you should do. I think that's key, and I think that's why both of them have made some of the choices that they have. It is really about the relationship that you have with your clinician, which is really important.
I would agree with that. Thank you, ladies, again, for sharing your experiences. And when one is looking to build that relationship with your clinician, it's important for the clinician to respect the cultural and linguistic aspects of the patient too, because that also will help foster open dialogue and adherence to the treatment and care that the clinician is recommending for the individual. Continuing with advice, and I know we just touched on individual concerns and fears that they may have. To all of the panelists, again, what advice do you have for individuals who may have HPV and fear telling their partner to get vaccinated?
For individuals that have HPV and are afraid to tell their partner, then that's probably not the partner that you should be with. Open communication, just like your physician, your clinician, you should have open communication with your partners. Everyone knows that a woman of a certain age, starting at 21, is going to get a Pap test. Having a Pap test means it's a screening tool. It's a screening tool for cancer. It's a screening tool to find out if you have the virus that can cause cancer. It doesn't make you dirty. It doesn't make you promiscuous. It's a preventative service to find out if you're at risk for cancer. And that's the way the conversation should go. Hey, I found out that I have a virus that can put me at increased risk for cancer. It's about me. It's about my body. It's about cancer. And if you want to be healthy, you are of age, I think maybe you should, if I have it and we've been together, there's a possibility that you have this virus as well. Now, men may not jump up and get cancer. If your partner is a woman, I would extremely, advise that if they're not vaccinated, that they do. I'm not saying that men are any less at risk, but I think cervical cancer is key, and it should just stay about the cancer.
Thank you, Dr. Walsh, for sharing that. And also touching if the individual identifies as a man or a boy that may have HPV, the importance of also speaking with your partner about HPV vaccine and their status as well. It's overall, how can one prevent the risk of getting cancer? And there are different types of HPV related cancers that one can get. Though rare for some men, as you mentioned earlier, but there are some HPV related cancers that individuals are able to have. Taylor, Alexandra, before I move to the next question, do you have any thoughts on that to add to Dr. Welsh?
I would just add, when possible, normalizing going to the doctors frequent, not only going when there's like pain or something is hurting, and to talk about those doctor's appointments that might make it a little easier to have those conversations with your partner around, what were the results when you went to go get tested.
Thank you for sharing that. Now, to all of the panelists, what are some ways that you do not get HPV from individuals that may think that there's a risk? So it's any misconceptions or misinformation that one may think that they can contract HPV, but that's not necessarily the case, that you may have heard of or within the community or within your clinical setting that you just want to make sure, dispel the myth, dismantle it, if you will, any misconception about it?
You can't get HPV from sitting on a toilet. You cannot get HPV from sharing a towel. You can get HPV, however, at birth. if mom has HPV genital warts in the birth canal. So I do want to say that.
Thank you for clarifying and sharing that. Taylor, Alexandra, have you heard any misconceptions or myths around HPV that you'd like to share or clarify?
I think the only thing that I've heard before is that when you say, oh, HPV or I have HPV, they just immediately assume that it means you have genital warts. So I think that's the main misconception that I've had to correct people on, that it does not mean that you automatically have genital warts if you test positive for HPV, and that the more general or the more pressing concern is the potential of it to turn into cervical cancer.
Thank you for sharing. That is a common misconception. Now, there are those, again, to all the panelists, that may know of individuals that may share, how come I've never heard of this being a risk or cause any concern, HPV? What is your response, or what are some responses you've heard to this?
It's mostly women of an older age that I've come in contact with that say they've never heard of it. To be honest, I haven't come in contact with too many young people that have not heard of it. They've heard of it at one point in time, either through their pediatrician when they decided yes versus no to get it. They've heard it through commercials. One Less was a very big campaign at one point in time for HPV. And I'm sure they've heard it at least once with a gynecologist. It is older women that don't feel as if it's necessary and it's important for them because they're not going to obtain the vaccine, that HPV doesn't ring a bell. To be honest, we've only been doing HPV testing maybe for the past 15 years. 20 years ago, HPV testing wasn't being done. Pap testing looked a lot different. It is now liquid based. So the whole test is a little different. And once we were able to culture HPV from the Pap test and the vaccine came out, that's when discussion became more prevalent. So people of an older age are really not well in tuned.
Thank you for sharing that, especially the HPV testing being so fairly new, if you think about it, and then how one may not have heard of it due to their age range. So thank you for sharing that context. Taylor, Alexandra, have you received that response, or anyone mentioned they've never heard of HPV and what their responses may have been?
I haven't heard that they haven't heard about it, but something that comes up is not knowing that you can still get the vaccine after a certain age. I think a lot of the messaging goes for like before you become sexually active, and that was the message for a really long time. At least the message that kind of came down to my community. So I would say that folks not knowing that they can still get the vaccine, well after being sexually active, as Dr. Welsh mentioned, between 27 and 45, I believe. Yeah.
Yes, thank you for making that point. I think that isn't a common misconception that once one hits 26, 27, they're no longer eligible, if you will, to get the HPV vaccine, and that's not the case. So encourage those to have the conversation with their providers to see, to learn more about the HPV vaccine and how that can be incorporated within their preventative care. Dr. Welsh, I have this clinical question for you. Can the HPV vaccine change one's menstrual cycle or cause infertility? And I think you started to touch on that. If you can unpack that more.
The answer is no and no. Can it affect infertility? I would say no. It doesn't affect the cells, hormonal cells. It doesn't change the makeup of the lining of your uterus. So for that reason, no. Can it change your menstrual cycle? I have yet to have a young woman say that their menstrual cycle has changed because of HPV. Now, as a gynecologist, young women come to me for a whole host of reasons, whether it be for menstrual irregularities or for birth control or for menopausal symptoms, even in young early 40s. So there's other medications that can affect your menstrual cycle, and just being stressed can affect your menstrual cycle. So there's other things that can affect it. The vaccine is usually not one of those things.
Thank you for sharing that and clarifying that. So just to piggyback on that, how safe is the HPV vaccine?
Well, if you ask me, the vaccine is extremely safe. I won't sit here and say that there's no vaccine that does not have side effects. The most common side effects are pain and swelling at the injection site. Anyone can have an allergic reaction. Patients have passed out in the office from any vaccine, and that's just from a sense of being overwhelmed and having that cortisol and those reactions in the body just explode. And I would really like to say I'm not aware of death from this vaccine. Has there been anyone that died? I can't give you testimony to a yes, but every single vaccine has an adverse event is reported to the vaccine adverse event reporting system. That includes HPV vaccine, that includes the COVID vaccine. So every single adverse reaction that any patient ever has, it's documented. And that's how we know whether that any vaccine should be pulled off the market because of adverse events. And I would just like to say, medications are pulled off the market every single day because of long-term side effects. I've yet to see a vaccine that has been completely pulled off the market because of side effects.
Thank you for sharing and clarifying that. That's really important information provided, that there's safety protocol put in place with vaccines and it's monitored closely. So that's reassuring to know. Excuse me, I'm just going through some additional questions that I received. Here we go. We're gonna open this up to all the panelists. Some individuals may feel like if they're honest about their sexual history, they may be stigmatized or poorly treated or judged by the clinician. So they may tend to forego or not follow up with medical care. Or they may not want to disclose information to the clinician. What advice do you give these individuals about what they can do if they have such concerns?
Don't go back. When you go to the hairdresser and you get a really bad hairdo, do you go back? You may go back one more time, but if you get a really bad hairdo the second time, I would beg to differ that you know that there's many different hairstylists around, that you can choose another one. Same with the physician. If you don't feel comfortable, don't go back. That relationship was not made for you. And I know many of us go to clinicians either from word of mouth or for convenience because they're close by work, close by home. But nail salons come a dime a dozen. Hairstylists come a dime a dozen. Physicians come a dime a dozen.
That is a really good analogy. Taylor, what were you going to share?
I would say I completely agree. I am lucky I had received my current gynecologist's information from a friend who raved about her. And so from the first intake, I just knew that I would feel very comfortable being completely honest with her. And it's been really beneficial to me to have her. So, but I would say exactly what you said. If you don't feel comfortable with your physician, then find another one. And if you don't want to go online and look it up, then just ask people that you trust. And, you need to build um, that trustful and honest relationship.
Agree with you both. And I know, Alexandra, you mentioned that too as well, the importance of having that trusted relationship with a clinician, being able to be open and honest. And if it doesn't gel the first time, or you feel a certain way, explore another clinician where you can build that trusted relationship with, because it is yourself and your care, and you want to make sure that you're able to get the best possible and feel comfortable sharing any concerns that you may have, and knowing that the care that you're receiving is good for you. So definitely agree with you, ladies. Just want to go back to some of them. We received another question in regards to, if an individual has an HPV infection, can the vaccine treat it?
There's no treatment for the HPV virus. There's preventative medication, there's preventative vaccines that can prevent the virus, but there's no treatment for the virus. There are many times, as Taylor said, that within 2 years or so, your body not necessarily can clear it, but your immune system is strong enough to suppress the activity that the HPV virus will entail. You could have one bad PAP in your 20s and never have a bad PAP again. That virus may never be seen again on a PAP. And there's some women that have an abnormal PAP frequently and frequently have to follow up, but there is no treatment for HPV, but there is treatment for the side effects that HPV can cause. Thus, pre-cervical, precancerous cells, genital warts, we have treatment for that, but we don't have treatment for the virus itself.
Thank you for that clarification, especially noting that HPV is not curable, but there is treatment for some of the side effects with HPV, associated with HPV. Is that correct, Dr. West? Okay. And you also mentioned a term or a phrase, if you will, clears up on its own. What does that mean for those that may not be familiar with this phrase?
I had rephrased the clear up on its own as opposed to lies dormant, not replicating actively in the cells, to the point where when you actually get a PAP test, you may not see it because it's not really active in the body. And it will be there for life, but you may not see it on in your cells because it's not active. I think those with low immune systems, folks that have high stress levels, that can cause a high activity of HPV, multiple sexual partners, meaning you're getting different types of HPV interacting, that can cause, a lot of activation of the HPV in the cells as well. So I don't think it clears up. You don't get rid of it, but it does lie dormant. I would say that.
And thank you for that clarification. Also helping understand one's risk and risk factors when it's associated with HPV. Here's another question we received. Some individuals have wondered if this is a concern, HPV for them, if HPV is a concern, if they do not engage in penis or vaginal sex, does this mean they cannot get HPV?
I think that is false. As I said, HPV is a virus, and it is transmitted through sexual touch. So you do not need penetration necessarily to obtain the HPV virus. But skin to skin contact, you can obtain the HPV virus genital to genital. Again, I try to relate it to herpes. Herpes, we know that you can get it just from kissing, and you have herpes cold sores on the mouth. And it happens just that frequently just from a kiss. So viruses are sexual contact. And when I say that, especially when I give STD talks, I really encourage young people, not that I don't promote condoms, I absolutely do promote condoms, but condoms are not going to protect you from viruses and will only protect you from STDs that we have treatment for. It will protect you from chlamydia and gonorrhea. It will protect you from even HIV. Gonorrhea and chlamydia we have treatment for. HIV we have treatment for, but it is lifelong most of the time. Viruses like herpes, viruses like HPV, it is sexual contact, so condoms do not prevent the spread. Okay, so when we're choosing our partners, choose wisely, but again, that is not, condoms are not going to be preventative for HPV. And syphilis, I meant to add, those are things that you have for life that are not prevented with condom use.
Thank you for that.
Makes it scary.
But we're here to get the information so that the individual can make the best informed decision for themselves and put into practice preventative measures to lower their risk. So this is the forum for that, understanding one's risk. So definitely appreciate the information that's being shared. It looks like we went through all of our questions for the evening. So I would like to give this moment to all of our panelists to share some remarks that you may have, or key golden nuggets, if you will, that you would like to share with our audience to take away regarding the HPV vaccine, understanding one's risk and how one can take on behavioral actions to prevent their risk for HPV.
I just want to leave off and say that as a physician, I'm more about preventative health. Many clinicians and many patients come in for treatment. And I try to get patients to avoid the treatment, to avoid the disease by just preventing it. Vaccines are one way of having preventative medicine, preventative measures. You know, your cancer screening tests are another way of having preventative measures in this country. So we shouldn't let things sit there and fester to the point where we're needing treatment, expensive treatments. Patients with hypertension and diabetes, we get to the point where we're giving you medicine so that you can continue to eat and be unhealthy. But we have to get to the point where we're preventing those diseases, and HPV is one of the biggest things. And we were almost at a point where it was rare to see death from cervical cancer. Now we're back up there where we were before, probably 20 years ago. We have an opportunity to prevent cancer, and it's at your fingertips. So I think we just need to take caution, take heed, and take the advice and get the vaccine.
Thank you, Dr. Welsh. Very important remarks that you just shared. Alexandra?
Yeah, I'll just add, to ask those questions, if your physician, primary care provider isn't bringing these things up to you, it's okay for you to ask your questions. I always like to say, go into the doctor's office with your little notepad and label it medical, and just any questions that come up. I think if folks are not sure what they can have access to, or what vaccines they should take, maybe even like a quick Google search, like entering your age and what vaccines are right for me, and you'll be surprised what might come up. But yeah, just definitely ask those questions.
Important to go in with your questions and be your best advocate and have them ready for your clinician. Definitely agree with that. And Taylor?
I just want to reiterate that if you are able to get the HPV vaccine, that you should. If you think that HPV won't affect your life or you won't come in contact with it, you will. If you test positive for HPV, you can still get the vaccine like me. And also how important routine checkups are, especially for women.
Thank you. Those were really key important points right there. And also everyone, all of your remarks hone in on the importance of preventative care, being one's advocate, asking the questions, and getting the vaccine and the benefits that it has to lower your risk to cancer, HPV-related cancers in particular. So just want to give our panelists a round of applause, or virtual round of applause again, for being with us this evening, sharing your perspectives on the HPV vaccine and your experiences, and really honing in on the importance of accurate information and how addressing the HPV vaccine helps one better understand their risk and knowing that there is benefit with getting the vaccine to their overall health. Your remarks provided rich information to share with our audience members, and we will follow up with some resources along with the recording to this webinar. So we hope that our attendees found the conversation to be fruitful and informative, and really do appreciate all of you for your time dedicated to join us this evening to share your perspective. So thank you again for your expertise. And last but not least, also appreciate the dedication that you have in your roles to the communities you serve. It is greatly appreciated. You are champions and truly appreciate all that you do for the communities you serve. So thank you again. So now we just want to take a moment. We will share a post-webinar survey to capture your thoughts. Again, to the attendees that are with us, please feel free to share your thoughts in the chat. Tell us what went well, what we can keep doing. If you have any additional questions that were not answered during this evening's session, please feel free to share it. We'll be happy to follow up with the panelists to see if we can get their response and share with our follow-up email. On behalf of the Office of the Assistant Secretary for Health here in Region 2, and also the New York Vaccine Literacy Campaign, we just want to thank you once again to our panelists and all of the attendees that joined us for this evening. We hope that you found the information shared valuable, and it's one step closer for you to make the best informed decision towards your care and for the care of your loved ones. Well, again, like I shared, we'll share the recording, some resources. I see that some are being put in the chat right now. We have some vaccine campaigns that are being offered through the Office of Women's Health, information on HPV vaccinations for young adults, as well as for healthcare providers. CDC also has some information. There's some tools that you can utilize with outreach and education efforts, and also share with loved ones or some of your peers. So thank you again for joining us, and take care and have a wonderful evening.